Today we are talking on an interesting topic of dental healthcare and gist. I'm an oral surgeon practicing in Mumbai since 21 years. I was diagnosed with gist in 2010 and was started on Glivec 400 mg. During the course of my treatment with Glivec, I've encountered various dental issues myself, and the idea took shape to address this topic for the benefit of gist patients who are on various drugs. It is important to know and understand about the various side effects of drugs and how to handle their oral complications. I will also emphasize on maintaining good oral hygiene. Maintenance of oral hygiene is of utmost importance for a good general health of a person. We will be discussing about managing only oral complications of three main drugs used in gist, namely Imatinib, Sunitinib, and Regorafenib. Now let us look at the normal structure of an oral cavity. A mouth is consisting of two major types of tissues. One is the hard tissues, namely tooth and bone. Second is the soft tissues, namely oral mucosa, gingiva, tongue, soft palate, and uvula. Gingiva is the mucosal tissue surrounding portions of the upper and lower teeth and bone. Hard palate is the front portion of the palate, which is formed by the process of the maxilla or the upper jaw. Mucosa is a mucous membrane which lines the oral cavity. Soft palate is the posterior portion of the palate. This is non-bony and is comprised of soft tissue. Tonsils are lymphoid tissue located in the oral pharynx. Uvula is a non-bony muscular projection that hangs from the midline at the posterior aspect of the soft palate. Vestibule is the space between the upper or lower teeth, gingiva, cheeks, and lips. Now, why I am describing the normal structure of the oral cavity is for you to familiarize with the structures so that when we talk about the complications, it will be much easier for you all to understand. Now, let us look at the normal tooth structure. The tooth is consisting of two parts. One is the crown, which is present in the mouth. Second is the root, which is embedded in the alveolar bone. The crown is consisting of three layers of tissues. First is enamel, which is white in color, is the outermost part of the tooth exposed to the oral cavity. Enamel is the hardest tissue in the human body, even harder than bone. Second is dentine, which is the layer below the enamel. It is yellowish in color and is a sensitive tissue as it has dentinal tubules containing some nerve endings. Hence, when the dentine is exposed in the mouth, it may lead to sensitivity or pain. The third or the innermost layer is the pulp, which is a vital structure containing blood vessels and nerves. Involvement of pulp in dental disease gives rise to severe pain. The root is consisting of three layers of tissues. First is cementum, which covers the roots of the teeth and is the place where the periodontal ligament fibers attach themselves to hold the tooth firmly in the alveolar bone. Second is dentine and the pulp tissue we have already discussed. The tooth is firmly held in the alveolar bone with the help of elastic periodontal fibers. Gum are the soft tissues, pink in color, and form a cuff around the neck of the tooth in the mouth. They are also known as gingiva. Alveolar bone is a hard tissue in which the roots are housed and anchored by means of periodontal ligament fibers. Now let us look at the common dental diseases. As you can see in the picture, the first picture is caries. It is one of the most common dental disease. It is also called a tooth decay. It leads to destruction of the hard tissues of the tooth due to acid made by bacteria, resulting in breakdown of the tooth surface. This commonly causes pain, sensitivity, and unpleasant aesthetics. The treatment is removal of the caries and filling, or in some cases root canal or crowns, and extraction in cases of severe dental decay. In the second photo you can see in the lower jaw, all the teeth are eroded. This is called as enamel erosion. Enamel erosion is caused due to acid reflux or heavy intake of acidic food and drinks. as well as it can be caused due to a heavy traumatic bite. It leads to loss of enamel structure, resulting in pain and sensitivity, and an increased predisposition to caries. Treatment is by filling, crowns, root canal in severe cases. The third picture we are seeing here is about fracture of teeth. The fracture of teeth is caused due to trauma, which is secondary to caries. The treatment again is by fillings in conservative cases, crowns, or root canal in severe cases. Now let us look at the other parts of the dental diseases. Gingivitis is the inflammation of the gums due to accumulation of plaque and tartar. Patients have bleeding gums or bad breath. The treatment is scaling or oral prophylaxis. Periodontitis is the infection of the periodontal structure, namely gums and the alveolar bone, resulting in recession of gums, pus discharge, bad breath, or mobility of teeth. Mobility means the teeth start shaking. Treatment is based on the severity of the condition, ranging from scaling to deep scaling to flap surgery or even extraction of the teeth. Now, as you can see in the first picture, you can see a lot of plaque and tartar accumulation in the upper and lower teeth, in the front teeth. The gingiva also, as you can see, is not pink in color. Pink is generally a sign of health, while in this case, you can see the gingiva is very angry red. And such gingiva just spontaneously bleed even on touching. There is also some amount of pus discharge which will be present on expression or on pressure. The next photo we see is about an abscess. It's a small boil in the gums next to the broken tooth. It is a form of a chronic infection. Treatment is root canal of the affected tooth or extraction. Aphthous ulcer, as you can see on the lateral border of the tongue in this photo, is the result of peeling of the epithelial layer of the mucosa, resulting in a raw area. The treatment is application of anesthetic gel and consumption of multivitamin supplements. Now let us look at stomatitis or mucositis. It is a painful inflammation of the oral mucosa. I will be discussing this in detail a little later in the presentation. As you can see in the first picture about the edentulous palate, the maxilla, the mucosa is extremely red in color, which is a very painful condition for the patient. Candidiasis is a white fungal infection of the oral mucosa. Again, this will be discussed later. In the second photo, you can appreciate the white fungal patches which are present on the cheek mucosa and on the tongue. Herpes infection is a viral infection seen in the third photo. It is of two types, herpes simplex or herpes zoster. Herpes zoster is restricted to only one side of the mouth. These are painful conditions and require a doctor's opinion. Now let's look at the common drugs which are used in GIST. Imatinib is the first line of drug in GIST. Sunitinib is the second line of drug, and Regorafenib is the third line of drug in GIST treatment. Now when we look at the complications of the drug, today we'll be just discussing the complications affecting the mouth. So we call them as oral side effects of Imatinib. In the first complication is hyperacidity, which leads to increase in caries incidence. It is important to control acid reflux and maintain a good oral hygiene for the same. Muscle spasm. Imatinib is known to cause skeletal muscle spasm all over the body. When it affects the jaws, it results in a locked jaw, in which your lower jaw clamps on the upper jaw tight, making it difficult to open the mouth. I've personally experienced this. You should consider calcium and magnesium supplements with the consultation of a doctor. If this situation ever arises, you should stay calm, wait for a couple of minutes for the spasm to subside, and massage your jaws and muscles. It will resolve on its own. The next complication of oral side effect of Imatinib is gingival recession. Gingival recession is nothing but development of spaces between the teeth due to receding gums. These spaces have a tendency to accumulate food, leading to irritation of the gums and decay of teeth. They can be cleaned with floss, interdental brush, or water flosser. Herpes zoster or herpes simplex are also one of the known complications. These are painful ulcers of viral origin. Please consult your doctor if you have painful ulcers which are appearing in clusters. You may be prescribed antiviral drugs. Candidiasis. It is the presence of a whitish coating on the oral mucosa. It is a fungal infection. It is treated with antifungal oral lotions or tablets. They are to be taken in consultation with your doctor. Now, all these topics which I'm talking about, you've already seen the photos in the previous slides. Another complication which may arise is the taste disturbances, also known as dygaxia. The patient may have partial or complete loss of taste sensation. This condition may severely compromise dietary intake. You have to make sure that you take enough nutrients through fluids or medication in form of multivitamins and minerals in consultation with your doctor. Sucking on mints, lemon, oranges, ginger, or cloves may provide relief. But in case you're sucking on a lemon or an orange, you have to be careful that you don't have any present ulceration in your mouth. Tobacco in any form is to be avoided. Stomatitis or mucositis is a painful inflammation of the oral mucosa resulting in the mucosa becoming red in color, sometimes along with ulcerations. Use of turmeric latte, folic acid supplements, vitamin C B complex supplements, or sucking on ice relieve symptoms. We should avoid spicy and piping hot food and drinks, which are irritant to the mucosa which is already thinned out and very inflamed. Use of a liquid anesthetic mouthwash relieves pain. Use a soft toothbrush. Rinse 3 times a day with 1 teaspoon of baking soda mixed with 8 ounces of water. Stevens-Johnson syndrome is an extremely rare allergic reaction which needs urgent hospital admission. Now let us look at the oral side effects of Sunitinib. The first one is the similar to Imatinib, is hyperacidity, which we already talked about. Stevens-Johnson syndrome, which is a very rare condition, allergic condition. Now let's talk about osteonecrosis of the jaws. It is an advanced disease resulting in destruction of the jawbone. Consider preventive dentistry prior to starting of treatment with Sutent. So whenever there are patients who need to be started on Sutent or Regorafenib, it is highly recommended that they undergo the major invasive dental procedure prior to starting this drug. If possible, you should avoid invasive dental procedures, particularly in patients receiving intravenous bisphosphonate treatment or patients having poor oral hygiene and pre-existing dental disease. In wound healing, Sutent is known to delay or impede wound healing. Hence, whenever you go to your dentist or your oral surgeon, please inform them about the drug that you are taking, and you may need to take a consent of your oncologist before doing any extensive procedure. Dry mouth, which is also known as xerostomia, is a condition where there is a decreased flow of saliva in the mouth, resulting in severe dryness, difficulty in eating, swallowing, and speech. Use of lubricating mouthwash or gels containing glycerine and methyl cellulose will help in moisten the oral cavity and relieve the symptoms, making eating, speech much more better, and patient will be able to have a better dietary intake. Stomatitis or mucositis. In such cases, the use of a liquid lidocaine mouthwash, use of a soft toothbrush, and rinse 3 times a day with 1 teaspoon of baking soda mixed with 8 ounces of water, as mentioned earlier. Glossodynia is a burning mouth syndrome, is mainly pain in the tongue. With the use of local anesthetic gels and multivitamins capsules help in relieving the symptoms. Now, Sutent is also known to cause bleeding. Now, the patients may have cracked lips or bleeding from the lips and gingiva. Any dental surgical procedure may lead to excessive bleeding. That is why please inform your doctor about your medication whenever to go for any dental treatment. Candidiasis is a fungal infection, is also a complication of Sunitinib. Now let's look into the oral side effects of Regorafenib. Now the common ones are hyperacidity, that's an increase in acid reflux, bleeding, which is already mentioned in Sunitinib, wound healing complications, which is again there in Sunitinib, stomatitis, mucositis, which is common for all the three, candidiasis, again, which is common for all the three, is commonly seen in patients with decreased immunity and diabetic patients. Now, Regorafenib patients are more prone for infection from any wound, any pre-existing dental disease in the mouth. They are more prone to have developed infection in that particular area. Now that we have known about the various complications which can have with the individual drugs, it is important now for us to understand how to take care for management of these side effects. First and foremost is to maintain a good oral hygiene. You should brush twice daily. You should use a soft or ultra soft brush if required. Use of a mouthwash, and please avoid an alcohol-based mouthwash, as alcohol-based mouthwash are known to irritate the mucosa. And in such patients who are on the GIST drugs, the mucosa is most of the times very sensitive, and presence of stomatitis and mucositis may worsen with the presence of an alcohol-based mouthwash. Use of interdental brushes will help in maintaining the interdental health of the teeth. Use of dental floss or water flosses is very convenient. You should complete invasive dental procedures prior to starting with the GIST drugs. Use oral dry mouth gels or mouth rinses for xerostomia. Apply anesthetic or oral gels or patches for mouth ulcers. Have soft, non-spicy foods during incidence of these oral complications. Routine dental checkups are a must every 6 months with oral prophylaxis. Now, since we are going about the oral complications, we should also be aware about the commonly used drugs in dentistry and their interaction with the GIST drugs. Because when you go for a dental treatment, it is likely that you'll be prescribed most commonly antibiotics and analgesics, which are painkillers. Now, in the first set of the drug interactions, let's look at the combination of ciprofloxacin, which is an antibiotic, and tramadol, which is a painkiller, which will interact with sunitinib, causing irregular heartbeat. It is a rare side effect, but can be a serious one if you have a pre-existing heart disease, or if there is electrolyte imbalance, that is, loss of magnesium and potassium due to prolonged vomiting or diarrhea, because which are quite common in patients who are on sunitinib or regorafenib can be having the symptoms. You should seek medical help if you feel giddy or lightheadedness or shortness of breath or heart palpitations during the treatment. Now then the next set, diclofenac, ibuprofen and ketorol, all three which are painkillers, interact with regorafenib, causing increased risk of bleeding. Yeah, be careful if you have to undergo a surgery or a tooth extraction. Watch out for signs of bleeding spots on the skin, bleeding through surgery site, blood in sputum, stools or in urine, and you should report to the doctor ASAP. Ibuprofen and tramadol interact with Imatinib. Both of these are painkillers and may increase the drug level of ibuprofen, tramadol in the blood. The doctor may modify your dose appropriately once he knows about the medicine you are taking. In case you have irregular heartbeats, inform your dentist so he can use a suitable anesthetic agent. Antacids, which are commonly used with all the drugs used in GIST, interact with the GIST drugs, decreasing the blood level. Ask for an antacid which does not decrease the potency of your GIST drugs. Imatinib may also reduce the effectiveness of codeine, which is an analgesic, again very commonly used in dental procedures. So by informing your doctor and your dentist, you can avoid these complications. It's important to be aware about your disease, about the drug you are taking, and the potential complications which associate and interactions with other drugs. Now let us look at the common dental procedures. The first one is oral prophylaxis. It's one of the easiest and the simplest of dental procedures. It is carried out by an ultrasonic scaling machine. It removes the plaque and tartar which is accumulated on top of the teeth. The second procedure is deep scaling or curettage. It is generally done in periodontitis. It may be done under local anesthesia. Dental fillings are done after removal of the dental decay or the dental caries. Root canal treatment is done when the dental caries is advanced and has reached the pulp chamber or resulted in a root infection. Root canal is a very effective treatment in saving of the teeth which otherwise could have been extracted. In minor oral surgery procedure, extractions, flap surgery and wisdom tooth surgery are commonly done. Implant surgery is not contraindicated in patients on Imatinib, but patients on Regorafenib or Sunitinib, it is not really advisable. As in the previous slides, you have realized that doing any invasive surgery in such patients who are actively on these drugs can result in delayed wound healing or even osteonecrosis of the bone. So you should avoid any aggressive dental procedures on patients on Regorafenib and Sunitinib. Crowns and bridges are relatively simple and easier to do for these patients. In patients who are having dentures and having oral mucositis or stomatitis, they may not be able to wear the dentures because of the sensitiveness to the mucosa. So in such cases, the dentures are soft-lined using a soft material which acts as a cushion between the denture and the mucosa. Thus, the patient can definitely much more easily wear such a denture and be able to eat well. Ideally, with Sunitinib and Regorafenib, the treatment is done during the washout phase, so complications are minimum. You should inform your dentist about the drugs you're taking and take consent from your oncologist before any dental procedure. Now, there were a few questions which were sent to us prior to this presentation. Now, the first of the questions was, should I have oral surgery to remove the residual bone that have broken from caps, breaking along with the existing 107 teeth I have left to have dentures? I will probably be taking Glivec the rest of my life as long as I can tolerate the side effects. The answer would be, please visit your dentist and make x-rays. If root stumps are to be removed, consider that there may be the source of infection in future. Please remove them. Inform the oral surgeon about Glivec. He may request stopping the drug for a short while in case the procedure is extensive. Please consult your oncologist before stopping Glivec. You can ask your dentist about possibilities of implants or continue to use dentures. In case your dentures hurt you due to stomatitis, then get the dentures soft-lined with a soft-lining material. The second question is it safe to have a dental implant while on Imatinib? Is it safe to have a root canal treated or tooth extracted? Yes, it is safe to do an implant. You have to inform your dentist and oncologist about the same and take permission for stoppage of Imatinib if required. Dental implants are not indicated in patients with Sunitinib and Regorafenib. Yes, it is also safe to do root canals, and root canal is a much more conservative procedure than extractions. So it is preferred, if possible, to do a root canal and save a natural tooth than extract it. The third question is, I go to regular checkups and even with keeping my teeth clean, flossed and mouth guard, I'm still having cavities and my dental is breaking down. I also have fluoride and use spray for dry mouth, but still have problems. I have no cavities or dental issues until been diagnosed with GIST. My answer would be both dry mouth and acid reflux contribute to dental decay. Take care of acid reflux, use of a water flosser, continue with the fluoride application on your teeth. There are these new remineralizing toothpaste which help in rebuilding the normal tooth structure back by repeated application. These may reduce your incidence of dental decay, and be regular with your dental checkups. Now, there may be sometimes cases where the patients will require urgent dental treatment, but the GIST drugs may be needed to stop for dental treatment. In such cases, the oncologist will be in a catch-22 situation of relieving the dental pain by allowing dental procedure by stopping the drug, or weighing the pros and cons of stopping the drug, which may lead to progression of the GIST. In such cases, informed consent is taken by the oncologist for the same. This is a non-commercial presentation. It's only for the information purposes. In case you are suffering from active disease, please contact your doctor for further treatment. Acknowledgement for the photos, sources internet, references from the drug manuals from respective companies, Imatinib by Novartis, Sunitinib by Pfizer, and Regorafenib by Bayer. And this references for the side effects. Thank you, ladies and gentlemen, for a patient hearing. I'm sharing my email address with you in case you have any further questions about this topic, anything about to do with dental treatment for GIST patients or with oral complications and how to manage them. Please be free to write to me. I shall try to reply to you as soon as possible. Thank you. Bye-bye.